Last year, you may recall the news story that covered the findings in one Timothy Ray Brown, also known as the Berlin patient, who was supposedly to be the first patient, quote-unquote, cured of his HIV after receiving bone marrow transplants in both 2007 and 2008. This is Brown here in the CNN piece covered by Sanjay Gupta. Brown initially received these stem cell transplants because of non-HIV related leukemia, but the transplants came from a person whose cells were found to be HIV resistant. After he received the transplants, Brown's HIV suddenly didn't come back, and he didn't have to take any antiretroviral medication anymore. Thus, scientists considered him cured at the time. However, the findings did show minute traces of HIV in some tissues, not whole virus capable of replicating, but pieces of viral genes. These traces raised even more questions. Nonetheless, the question I dare to raise from this article is what ways we can better improve our detectability so that researchers can at the very least be on the same page when it comes to a final diagnosis. In this article alone, one of the very scientists who conducted and presented the data of these findings, Dr. Stephen Euckel of the University of California, San Francisco, stated, the point of presentation was to raise the question of how we define a cure, and at this level, how do we know the signal is real? There are several different kinds of modern detection techniques out there, from virus isolation and serology, like ELISA, to nucleic acid amplification procedures, including polymerase chain reaction, nucleic acid sequence-based amplification, or NASBA, and loop-mediated isothermal amplification, otherwise known as LAMP, which were developed for most respiratory viruses by the end of the 1990s, as well as today. Multiplex PCR, coupled with fluidic microarrays using microbeads or DNA chips, represents the latest diagnostic approach for the clinical laboratory and completes the evolution of diagnostics for respiratory viruses. Molecular testing has also greatly improved the laboratory's ability to diagnose viral respiratory tract infections. And without exception, nucleic acid amplification tests, otherwise known as NAATS or NATs, which first emerged in the 1980s for HIV, have been shown to be more sensitive than non-nucleic acid-based tests. The increased sensitivity means that infected patients will be diagnosed more accurately and more often, especially at times during the course of their infection when they are shedding low levels of the virus that would be missed by non-molecular tests. This brings me to my final story, which is a brand new news story about a baby in rural Mississippi being born with HIV initially, but was given high doses of 3 antiretroviral drugs within just 30 hours of her birth.
So we have, several people have asked me, in the years to come, will this baby get HIV again because she has these little remnants still in her body? Is that possible?
That's still a possibility, and we're going to be following the baby for a while to make sure that virus does not come back. However, at this point, she's been off of medicines for quite a long time and still has no return of virus. And this is unique. We've not seen this in other cases before.
So off of medicine for 5 months, but no virus in her body except these little remnants. She's perfectly healthy now, correct? Am I right about that? You're not treating her for HIV? She's just like any other baby?
She's not being treated, yes.
Wow, that really is amazing.
Doctors knew the mother was HIV positive and administered the drugs in hopes of controlling the virus. But yet, 2 years later, there is no evidence of HIV in the child's blood whatsoever. The Mississippi girl is the first child to be, quote-unquote, functionally cured of HIV, researchers announced at the 2013 Conference on Retroviruses and Opportunistic Infections in Atlanta. They said they believe early intervention with the antiretroviral drugs was key to the outcome. A quote-unquote functional cure is when the presence of the virus is so small, lifelong treatment is no longer necessary, and standard clinical tests cannot detect the virus in the blood. And in this case, as explained by Dr. Hannah Gay, the pediatric HIV specialist at the University of Mississippi Medical Center, who was the lead person responsible for this new incredible finding, the HIV virus was blasted into remission with an accelerated program of medication and was prevented from taking root into the baby's cells.
Our current hypothesis is that because she started early aggressive therapy, she started therapy at 30 hours of age, that we think that maybe we were able to prevent the viral reservoirs, or what I call for my patients the hiding places, from ever being seeded with virus.